So just get yourself sat nice and comfortably. If you're comfortable sat cross-legged, if this is a good position for you, then that's fantastic. But if you are struggling with your hips and your pelvis, or you're just not comfortable sat cross-legged, then do try some different positions. Sit with the legs out in front of you so that you're sat in the thunderbolt position, or you could also try coming up onto your knees. If you do come up onto your knees, I would recommend a little blanket or a little cushion in between your heels and your bottom, just so that you get a really good comfy position. And if any of you do start to feel a little bit uncomfortable whilst you're sat cross-legged, you could always try popping a little blanket or a cushion underneath the coccyx, right underneath your tailbones, just to lift you slightly higher up, just to elevate the pressure on the coccyx. But you could also try sitting on a yoga block if that helps you to get comfortable. So when you're ready and you're sitting comfortably, however that is, bring the hands onto the knees, palms facing up. Close your eyes and just start to take a nice big breath in through your nose for 4 and out through your mouth for 8. In through your nose for 4, out through your mouth for 8. As you inhale, I want you to take the breath right the way down into your belly, puffing that tummy out as you inhale. And as you exhale, blow the breath away, keeping the face muscles relaxed, your jaw soft, your mouth open, and just blowing that breath as far away into the distance as you can. In through your nose for 4, and out through your mouth for 8. Just letting the muscles of your face soften, your jaw relaxed, the mouth open, and just blowing the breath as far away into the distance as you can. With every exhale, let the shoulders drop down, releasing any stress, any tension that you might be holding in your neck and your shoulders. And as you exhale, blow the breath away. As you exhale, I'd like you to slowly bring your chin down towards your chest. Only as far as feels comfortable, just feeling that lovely stretch at the top of the back, the neck and the shoulders. Keep taking your lovely big breaths in and out. And as you exhale, I'd like you to take your chin a little bit further down if it feels comfortable. Just always listening to your body, only doing what feels most right to you right now. And as you exhale, I would like you to slowly take your right ear over to your right shoulder. It's ear to shoulder, not shoulder to ear, so keep the shoulder soft and relaxed, taking the ear as far over as feels comfortable. So you're feeling that lovely stretch here into the side of the neck and into the shoulder. If it feels comfortable and you're enjoying the stretch, take the ear a little bit further over, only as far as feels comfortable, and keep taking those lovely big breaths in and out. As you exhale, slowly bring the chin back down to the chest. Take a breath in and out. And as you exhale, slowly taking that left ear over to the left shoulder. Just making sure that you keep the shoulder relaxed and soft, and taking your ear as far over as feels comfortable. Keep taking those lovely big breaths in and out. And if it feels comfortable, let the ear come down a little further. And when you're ready, bringing the head up into the center. And I'd like for us to get a little bit more movement into the neck and the shoulders, just really helping to release any tension that you might be holding in the neck, the shoulders, and the top of that back. I'd like you to roll your shoulders up towards your ears, rolling the shoulders back. If it doesn't feel comfortable to roll them back, please feel free to roll them forwards if that feels more comfortable. So as you take the shoulders up towards your ears, rolling the shoulders backwards or forwards, getting lots of lovely movement into the neck and into the shoulder. If it feels comfortable, you could try inhaling, taking the shoulders all the way up towards your ears, and as you exhale, let the shoulders relax and drop down. You could also try taking the chin down to the chest and gently rolling your head round. It doesn't matter which direction, and it doesn't matter how fast or slow that you move. Just listen to your body and use what feels most right to you right now. And when you're ready, bring your head up into the center and bring those hands back to rest onto your knees. As you inhale, I'd like you to take your hands and bring them together into the prayer position. As you exhale, feel your breath over the tips of your fingers. As you inhale, slowly take your hands up above the head, keeping your elbows soft, your shoulders relaxed. And I would like you to take your eye line so that you're looking up at your thumb, so looking up towards the ceiling. Nice big breaths in through your nose for 4 and out through your mouth for 8. We're really helping to open up those muscles around the rib cage. We're really helping to create more space, but also really importantly helping to create more space, making it easier to breathe. And as you exhale, slowly bring the hands back down into the prayer position. Let yourself have a breath in and out. And as you inhale, I'd like you to take your hands all the way up above the head again, keeping the elbows soft, keeping your shoulders relaxed, and taking your eye line so that you're looking up at those hands. Nice big breaths in through your nose for 4 and out through your mouth for 8. So we're creating space in the chest area, but we're also helping to create space in the tummy area as well. We're really helping to release those uterus ligaments. We're helping to create space in the tummy area as well. We're helping to create more space for baby to get into that optimal fetal position over on the left-hand side. But we're also helping to create space for you, helping you to feel more comfortable. As you exhale, bring the hands back down into the prayer position and let yourself have a breath in and out. As you inhale, I'd like you to slowly take the hands up above your head. This time, I would like you to interlink your fingers. And I would like you to start to circle the hands round above your head in a clockwise direction. So we're rotating from your left to your right knee. Nice big breaths in and out as you circle around. Now the reason that I want you to rotate in a clockwise direction is because we're working with your digestive system. As we circle around with these hands up above our head, we're gently massaging into that whole tummy area. So this is a great movement if you're struggling with the digestive system. For the majority of us, it does slow down in pregnancy and can be the cause of heartburn, indigestion, constipation, trapped wind. So this is a great movement to remember if you are ever struggling with any kind of digestive discomfort. But just remember, always rotating in a clockwise direction. And bringing those hands up above the head. And as you exhale, slowly bring the hands back down into the prayer position. Let yourself have a breath in and out. And as you inhale, I'd like you to slowly take your hands all the way up above your head, reaching up lovely and tall through those fingertips so that you're really lengthening your spine. And as you exhale, I'd like you to take your hands out to the side so that we're in a lovely big V shape with those arms. Make sure you're not hunching the shoulders up here. Make sure the shoulders are soft and relaxed. And you're reaching out through those fingertips. We're really opening up the muscles here across your chest, but also really importantly, those muscles at the top of the back across the shoulder blades. So any of you struggling with upper backache, tension along those shoulder blades, this is a great stretch. Really, really helpful to alleviate some of that discomfort. As you inhale, bring the hands back together above your head. And as you exhale, bring the hands back down into the prayer position. Let yourself have a breath in and out. And as you inhale, we'll take those hands up again. Reaching up lovely and tall, lengthening the spine. And as you exhale, taking the arms out to the side into that lovely big V shape. Reaching out through the fingertips, breathing as you stretch. If it feels good, if it feels comfortable, feel free to reach a little further out through those fingertips, really deepening that stretch. And as you inhale, bring the hands back together above your head. And as you exhale, I want you to slowly bring the hands down onto the floor in front of you. Now, if you are struggling with the hips and the pelvis at all right now, then you might find that keeping the hands closer to the body will reduce the pressure on the pelvis and make this a more comfortable position. But as always, always listening to your body, only doing what feels most right to you. If you would like a deeper stretch, you can walk those hands a little bit further forwards, and you can just let the head hang loosely in between your arms. Just breathing in your own time. We're really helping to release your psoas muscle here. The muscle that starts in the middle of your back, comes in through the pelvis and connects to your inner thigh. And the more we can help to release that muscle now, the more space we can help to create, helping those hips to open and to widen when the time comes for baby to make their journey. And slowly walking those hands back up the mat, bringing yourself back onto that lovely seated position, however that is for you today. Hands back onto the knees, sitting lovely and tall. Remember to think about your core posture, so sitting lovely and tall, lifting yourself up out of the pelvis. If it helps, have a visual reminder. Just imagine a golden thread lifting you up from the crown of your head, gently lifting you up out of the pelvis. Make sure the shoulders are soft and relaxed. Your face muscles are soft and relaxed. And as you inhale, I'd like you to take your right hand over to your left knee. Now, if you're struggling with your hips and your pelvis at all today, stop here. Don't overdo the stretch. But for everybody else, take that left hand behind you up against your back and your bottom, and then looking over your left shoulder to complete the twist. Nice big breaths in and out as you twist round. Breathing into the stretch. If it feels comfortable and you would like to deepen the stretch, feel free to twist a little further round, but as always, always listening to your body. We're really helping to target this upper middle part of your back here, roughly where your bra line would sit. And often we get a lot of muscle tension and spasm that radiates round into the rib cage, and this twist is fantastic at helping to alleviate that. As you exhale, bring the hands back round onto the knees. Take a breath in. Take the left hand over to the right knee. If you're struggling with the hips and the pelvis, remember, just stop here. Everybody else, take that right hand behind you, up against the back and the bottom, and then looking over your right shoulder behind you. Nice big breaths as you relax and release into the twist. Lovely big breath. It's a lovely twist for encouraging all that amazing spinal fluid to flow. The more spinal fluid we can encourage, the more it helps to alleviate backache, but the more it helps to prevent backache as well. Exhale, slowly bring the hands back round onto the knees. Have a little wiggle over those seat bones. Just make sure you're sat nice and evenly, nice and tall. And I'd like you to come back to your breathing. Taking that breath in through your nose for 4 and out through your mouth for 8. As you inhale, taking the breath right the way down into the belly, puffing the tummy out. And as you exhale, blow the breath away. In for 4 and out for 8. As you exhale, make sure you're keeping the face muscles soft and relaxed. Your jaw is relaxed. Your mouth is open. And imagine blowing that breath as far away into the distance as you can. Making sure as you exhale, you're letting the shoulders soften and relax and drop down. And when you're ready, I would like you to add a seated rotation. It doesn't matter how big or small your circle is right now. It doesn't matter how fast or slow that you move, and it doesn't matter which direction. Just listen to your body. Try and tune in to what feels most right to you right this minute. Just focusing on your breath and focusing on the movement. This is an amazing movement to use right now in pregnancy. If you're struggling with discomfort underneath like the hammock of the bump, or right the way down towards your tailbone, right down towards the coccyx, this is an amazing movement for you. As we rotate and circle those hips round, we're helping to release your uterus ligaments. And we have uterus ligaments that anchor at the front, underneath the bump, and right the way down towards the bottom of the back where your coccyx is. And often those uterus ligaments tightening is the cause of that discomfort. And these hip circles can really help to alleviate that. You don't have to do your hip circles seated as we are now, but you could do them standing, you could do them sat on your birthing ball if you have one. You could come onto your all fours and you could circle your hips around that way. But it is an amazing movement to really help to alleviate tightness under the bump and down towards the bottom of your back if you are starting to really struggle as that bump gets bigger and heavier and applies more pressure to those uterus ligaments. It's also an amazing movement to use when you go into labor. As you rotate, you roll your baby's head over and over on the cervix, and that helps to stimulate the release of that hormone oxytocin. And the more oxytocin our body produces whilst we're in labor, the more effective and the more productive your contractions will be, meaning less contractions before you get to meet your baby. And when you're ready, slowly bring yourself up into a seated position.